Good morning and welcome to today's briefing sponsored by the California Department of Healthcare Services and brought to you by Ethnic Media Services and California Black Media. I'm Sandy Close, EMS Director, and today's moderator. Between June 2023 and May 2024, more than 15 million Medi-Cal members, 1/3 of the state's residents, will have their eligibility redetermined as part of the great unwinding of Medicare enrollees now underway across the country. Speakers from the California Department of Healthcare Services and Covered California will update reporters on steps the state is taking to ensure all eligible Californians have continuous coverage. Leaders of healthcare nonprofits working on the front lines will share information about the impact they are seeing among Black, Latino, AAPI, and Native American enrollees, especially older adults and children. This is the second in a series of briefings tracking redetermination that the Department of Healthcare Services is sponsoring to ensure that all communities are informed. Our speakers today include Yingjia Huang, Assistant Deputy Director, the Department of Healthcare Services, who will share the first data available on who has been dropped from Medi-Cal and what their options are. Jessica Altman, CEO of Covered California, who will talk about efforts to provide continuous coverage to those who have been or may be dropped from Medi-Cal. Louise McCarthy, CEO of Community Clinic Association of Los Angeles County, who will share early reports from her member clinics on how communities of color are faring in the county, what she calls the canary in the coal mine for the state. Rosario Arreola Pro, COO of California Rural Indian Health Board, Inc., who will share the central role Medi-Cal plays in healthcare for Native Americans. Dr. Cecilia Aquino, ED of Latino Coalition for a Healthy California, who will discuss why the largest number of enrollees who have been dropped from Medi-Cal are Latinos. Myra Alvarez, Executive Director, Children's Partnership, who will talk about the impact redetermination has on California children and youth. We ask speakers to speak slowly so our interpreters in Spanish, Mandarin, and Korean can keep up with you. And reporters, please enter questions in the chat. If speakers will monitor those questions and respond where appropriate on the chat, that will expedite the number of questions we can address. We are joined by Maria Romero Mora from DHCS, who will also be responding to questions on the chat. We'll send a video of today's briefing and bios with contact information for each speaker to all participants later today. And we encourage our media to let us know if you want to do follow-up interviews with any of the speakers, especially our broadcast media colleagues. We begin with Yingjia Huang. Welcome to the briefing. Thank you for kicking this off.
Hi, thank you, Sandy, for the warm introduction. Good morning, everyone. I'm Yingjia Huang from Department of Healthcare Services. Nice seeing many of you here again. So I'm very pleased that this briefing is occurring at this time. Last week, the department has posted our first set of redeterminations outcomes and our data. As many of you know, the Department of Healthcare Services is reviewing the eligibility of 15 million Medi-Cal enrollees, more than any other state in the country. And we're using this moment to really implement meaningful changes that will make it easier for our members to get and stay covered in the next few years. At the same time, we're also enrolling new members into our program. And so it's very important for us that we're providing the resources to help them transition into other programs if they're found ineligible for Medi-Cal. So last week, the department launched our first interactive dashboard that actually shows a snapshot of where we are. June was the first month that we began the disenrollments of our members in the Medi-Cal program. And we have a first set of outcomes. And I think in summary, California has disenrolled 21% of the members that were up for redetermination. Just for context, we have over 1 million members that were up for the redetermination process in the month of June. And that's on average for all the remaining months of the unwinding through May of 2024. We are anticipating a very similar volume of people, so 1 million each month, a little over that as we progress. In June, we disenrolled 21% of our Medi-Cal members, and that is actually a very relatively lower number in comparison to many other states. And the disenrollment is because the member did not return the renewal packet. As many of you remember, Medi-Cal is sending out the renewal packet in the yellow envelope. And so a big portion of the 21%, which is 225,000 individuals, were disenrolled because they did not return their packet to the county for processing. But it's very important for folks to know that even though if you were disenrolled for not returning the yellow Medi-Cal packet, you have 90 days from June, so through September 30th, to come back and return the packet to the county, and then you will get reinstated in Medi-Cal. So it's very important, and we have wanted to share broadly that there is that call to action. There is a way to get back on the program if you're part of the 225,000 individuals who were disenrolled. And with our Cover California partners here, we have designed, under the leadership of Cover California, a way for our members, if they're found to be no longer eligible for Medi-Cal because they're over income, to transition smoothly over to Cover California. As Sandy shared, we have designed a way for our members to seamlessly move between coverage programs, and so that they don't have to go through much of the administrative burdens needed to go through various applications to get coverage. So there's a portion of the 225,000 that are also moved over to Cover California as a result of the redetermination outcome. And we are all together taking an unprecedented set of actions to keep our members in coverage. We're funding health enrollment navigators in the community, over 150 community-based organizations to help us help our members fill out redetermination packets to answer all their questions on redeterminations, because we know our health enrollment navigators are a central part to the success, because they understand the communities that they work with. So we're deploying them across the state to help with the paperwork. We know the redeterminations process, can be difficult and complex. And so we have them, and we're doing trainings with them as well to make sure that the navigators understand how to help our members fill out their applications. And we have them for the next few years as we're going through this, not only just for the redeterminations process, but on a go-forward basis to help new members that come into our program for application help, for example. We're also working with schools. So Department of Healthcare Services was launched the back to school toolkits because we know the back to school season is here. So we have what we call data use agreements with 220 local educational agencies that has the information that they could help the department send out to families that are on Medi-Cal, because we know back to school season is where parents will pay attention to a lot of the messages that their children bring back to them. So we have flyers, we have FAQs for the teachers, also letters for them to provide to the students so they could share with their parents in terms of the need for completing the redetermination packet. And our managed care plans, which is the various managed care plans that we have in Medi-Cal today, also have the same set of information in terms of renewal dates to really help their members and do calls, do postcards to our members to remind them of the importance of this need. And something that really does keep me up at night as we're going through this process. June, we came out of the process very thankful that we have a majority of our members retained and they had coverage at the end of June. But it really does, as we're going through the unwinding, it's only the first month of data. And we have a lot more to do as a state agency and with our partners here on the call to really broadcast the message of, if you lost coverage in June, you still have 90 days to come back and get reinstatement into your Medi-Cal. And if your renewals are coming up, please make sure you're looking out for the yellow renewal packet. The counties will be reaching out. Check your text messages, check your emails. We're calling, we're texting, we're emailing to do reminders. And we really hope that in the next 11 months, as we're going through the remaining parts of the unwinding, that we continue to keep our members on coverage. And as I shared, we're very committed to doing everything we can and continue to work with our partners in the community to make that happen. Thank you so much.
A very quick question. California is leading the way in trying to ensure there is continuous coverage for as many people as possible. How does California compare with other states in making investments to keep people on rather than to kick them off?
Yes, thank you for the question. So we have elected a majority of federal flexibilities to retain individuals on coverage. And I think there's some questions too in the chat that 250,000 individuals being disenrolled is a huge number. Truly that is from a raw number perspective. We understand that. However, just wanting to contextualize that not only are we keeping a lot of people who may currently have other forms of coverage that may not want Medi-Cal in the program. So they did choose not to return their packets. In comparison, I think other states in the nation have higher disenrollment rates compared to California, just kind of in consideration of their redeterminations caseload, which is smaller than us, but they have also a higher disenrollment rate. So across the board, our investments, whether it be in our health enrollment navigators, our managed care plans, or the coverage ambassadors that we have launched. And right now we have over 3,500 coverage ambassadors across the state to help us push this message. And also a suite of federal waivers to help us so that we're not burdening both the member as well as the counties as they're processing this, so that this will be more seamless and quicker and more efficient.
Okay, thank you very much. Please stay with us. There will be more questions. Our next speaker is Jessica Altman, CEO of Covered California. Thank you so much for joining us, Ms. Altman.
Thank you so much for having me, and good morning, everyone. I want to just start by thanking Ethnic Media Services for hosting this much-needed briefing on this critical issue that, as Yingjia talked about, will affect over 15 million Californians over the next year, and want to particularly acknowledge Sandy for the warm welcome and for hosting us here today. As Covered California's CEO, I am just very proud to be a part of this distinguished panel. Glad to be here alongside Yingjia and our partners at DHCS, who we have been working hand in hand with really for years now to prepare for this moment, as well as so many of our state's leaders who are doing this work in our communities and across our state each and every day, including Rosario, Louise, Dr. Aquino, and Myra Alvarez, who I'm also lucky to call a board member of Covered California. Both Sandy and Yingjia already provided a lot of the background information on how we got here, and I've seen some good questions about where Covered California comes into the mix in the chat, so hopefully I'll answer a lot of those as I go through my remarks, but I'm sure there will be more questions. So I'm going to jump into what Covered California's role is as we work to ensure Californians remain covered as we go through this process. As mentioned, the unwind process is taking place in states across the nation, but California really is especially well positioned to support consumers through this process and help them keep coverage. We're incredibly proud of the work that our state has already done to reduce California's uninsured rate from 17.5% before the Affordable Care Act passed to just 7.5%, which is the largest reduction of any state in the nation, and shows the power of what we as a state can do when we are fighting and working to keep people covered. And we're committed to doing our part in protecting those gains as we go through the unwind process. As Yingjia mentioned, first and foremost, the goal is to keep anyone still eligible for Medi-Cal on Medi-Cal. But we also know that there are many reasons, including changes in income and employment, where some people will no longer be eligible for the Medi-Cal program. And that's where Covered California will step in, helping many of those transitioning from Medi-Cal keep coverage through quality health plans and access robust financial assistance that will help pay for monthly premiums, often at little or no cost to them. Most Californians who lose Medi-Cal coverage but qualify for Covered California will be able to get coverage at either no or low cost each month. In fact, early data shows about a third of those coming over from Medi-Cal are finding $0 monthly premiums on Covered California. Nearly 90% of our enrollees receive financial help, and 2/3 of our enrollees are eligible to pay $10 or less per month for their health insurance. And thanks to a new program supported by California's legislature and the governor beginning on January 1st, 2024, so soon after and even before many of these transitions will happen, we'll be entirely eliminating deductibles for over 650,000 of those we enroll, anyone under 250% of the federal poverty level covered through Covered California. So talking about process a little bit, empowered by a new law, Senate Bill 260, and in partnership with DHCS, we have now launched the Medi-Cal to Covered California enrollment program to help those no longer eligible for Medi-Cal avoid gaps in coverage. That program started in June and aims to provide eligible Californians with the most seamless transition we can provide from Medi-Cal to a health insurance plan offered by Covered California. When an individual goes through the renewal process and is determined to be no longer eligible for Medi-Cal coverage, Medi-Cal then sends that information to Covered California. We will go ahead and take that information and automatically select a plan for that consumer that offers the best value and the greatest level of financial assistance. Consumers, of course, have the opportunity to review this plan, keep the one we've selected for them, or choose another one based on their preference. Senate Bill 260 and the Covered California to Medi-Cal enrollment program are changing the way, Medi-Cal to Covered California program, let's not get that backwards, are changing the way we think about and support Californians in transitioning from one form of coverage to another and doing it more seamlessly than it has ever been done before, which is going to play a significant role in keeping Californians enrolled in healthcare coverage, even after they may be redetermined no longer eligible for Medi-Cal. And this is a process that will continue past the unwind, past May, and will continue to deliver more seamless transitions to California on an ongoing basis. While we are working to make the transition from Medi-Cal to Covered California as easy as possible, we do recognize that for many people, that transition and fully understanding their options, what it means, what's different, can be confusing. And that's why we, again, totally coordinated with Medi-Cal and our partners at DHCS, are reaching out to all communities across the state in their preferred languages to make sure they understand their options during this process and don't lose access to healthcare. Similar to DHCS's efforts and aligned with them, we have made earned media pushes about the Medi-Cal transition to Covered California in Spanish and Mandarin, along with television ad campaigns in those languages, as well as Cantonese, Korean, and Vietnamese. In addition, Covered California has created radio, digital, and social media ads, as well as educational videos that walk consumers through the process of how to create an account, review their coverage options, and learn how to sign up for coverage through Covered California. We hope to reach as many Californians as possible, regardless of their language or how they choose to receive their information. We know that millions of Californians choose ethnic media outlets like yours to stay informed, and we're so grateful for all of your support in helping us to get the word out to the communities that you are here to inform. Together, I have faith that we can ensure everyone has access to the information they need about this process and how they can keep covered here in California. So thank you for joining us today, and I look forward to answering any further questions that you have. And also going forward after today, happy to take questions through Covered California's media line on an ad hoc basis.
Thank you so much. In the interest of time, I'm going to read a couple of questions. Normally, we would ask our media to ask them directly, but the time is very limited. So here's a question from Lydia Sidham, which is, do you have, and I guess this is for Yingjia, do you have a breakdown of how many people lost coverage per county in June?
Yes, we do. I can post the link in the chat. Our dashboard does break it down by counties.
And this is a remarkable transparency that I think is unusual in terms of sharing data and holding yourselves accountable to actually have a goal of inclusive coverage, continuous inclusive coverage, and being willing to share the data where it perhaps doesn't show that it may show higher rates of disenrollment than has been the goal of DHCS. So it's really worth noting that there is a dashboard of data available to all of us. We have another question, which is, are people going out in the community door to door as they did with the census? And that comes from Denise Gibbs.
Yeah, so we actually have, I think there are some health enrollment navigator organizations in the community who is using that strategy. On our end from the state, we're very flexible in terms of the strategies they use. And we trust that the strategies they deploy at the local levels and they know best as the trusted messengers of the community. So there, I believe, are individuals in the state in terms of communities that are doing that.
Great. And we have time for one last question. I hope our speakers will check the questions on the chat. Araceli Martinez asks whether there are any figures for ethnic groups that have been more likely to be disenrolled than others. And I think we'll hear from our speakers about this, but is there any information on groups that have higher rates of disenrollment?
Yes, and in the dashboard link that I just included, we do break it down by ethnicity. So you have a discontinuance or a disenrollment slide, and you could actually see depending on what they have attested to in their application, what they identify with. We do have a large population of Hispanic individuals as well as white populations who are disenrolled as part of the process. So just wanting to share that. We have transparently shared this information in the dashboard, and you could go and click through by counties or demographics based on that.
Thank you. And for Ms. Altman, there are a number of questions about whether or not people will be able to afford covered California. And I think you addressed that in your remarks, but if you wouldn't mind addressing those questions from Sunita Sarabji, among others, in the chat, that would be very helpful for all of us, I think. We're now going to go to 4 speakers who have been supported by grants from the Department of Healthcare Services to be the navigators, to really support navigators who can work directly with enrollees. And we're asking our speakers to share what they're seeing happening on the ground and what their concerns are at this point. So we begin with Louise McCarthy, who is with the Community Clinic Association of LA County. Louise, thank you for joining.
Great. Thank you very much, Sandy. And thanks, everybody. It's great to see that we have 103 people on this morning, which definitely shows the importance of this issue. So as mentioned, I'm Louise McCarthy. I'm the head of the Community Clinic Association of LA County. I will slow down for the translators. Sorry about that. We are the coalition of all of the community health centers, the nonprofit private community health centers in Los Angeles County. So that's from Antelope Valley down to Long Beach, from Venice into the San Gabriel Valley. There are 113 organizations across our county, all nonprofits. They have just under 400 sites, and they serve 1.89 million Angelenos every year. 1.89 people in Los Angeles County are served by community health centers, and 64% of those are on Medi-Cal. So it is really crucial for the community health centers. Community is our first name. It is really important for the community health centers to help their patients, their clients, maintain continuous coverage so that they can continue to access the services to which they're entitled, especially for patients who might be in the middle of getting services, in the middle of getting referrals for specialty care. It's absolutely critical that they maintain their services, that they maintain their coverage. Now, LA, Sandy mentioned, I refer to us as the canary in the coal mine. Well, rather than fall over, this canary is going to sing about what's happening in LA. We are about a third of California when it comes to a lot of metrics. So she mentioned 15 million enrollees statewide, 4.4 million Medi-Cal enrollees in Los Angeles County. So as we think about the role of the counties, it's important to note that, California, first of all, we're lucky to be in California. We're in a state that's willing and working to keep people enrolled into coverage and expanding coverage at the same time. Yet, even with the best intentions, the work is going to be hard. And we are doing that work, both at the state level and locally. So critical to the state's success are the counties. Counties are the gateway to enrollment into Medi-Cal. So that's for Medi-Cal, that's for CalFresh, CalWorks, General Relief, and assistance programs for immigrants. Counties are the gateway to accessing those programs. So the resumption of renewals, as well as the upcoming expansion of Medi-Cal eligibility, is going to test the capacity of our county departments and partners, such as the health centers, to help folks get and stay covered. So the source of our success is going to be resources, human resources, financial resources, and technical resources to support these efforts. So health centers are working now to help their clients. When folks get that yellow packet, they can call the County Department of Social Services. They can also go to their community health center. They can take the yellow packet. They can call their community health center. Most often, phone is the way that folks interact with their enrollment workers. There are enrollers at the community health centers who can help. They will help with the paperwork. They will help navigate the benefits Cal system. They will often even get on the phone with the county, with their client at the same time to help them navigate the system. So as mentioned, there are helpers, there are navigators, and luckily our state invests in them. So there is, as Sandy mentioned, there is a navigator funding from the state, and that the governor actually increased funding for that by about $10 million for health enrollment navigators for this fiscal year, in addition to ongoing funding that they had. That is really for it's distributed by the counties, and not too many health centers get that resource, but there's a new resource that it's an additional $60 million in the state budget that's going to support enrollment at community-based organizations. So the state is working to get that funding out quickly to help these community-based organizations. Look, the community-based organizations are going to do this even before the funding comes, because we're mission driven to make sure that our patients retain access to the services to which they are due. So as we think about the ways in which your readers are looking at this issue, if there's language access issues, their local community health center has folks who can support them with that. If there's even just navigating bureaucracy, all kudos to our state friends, but it's still a bureaucracy. The community health centers and other community-based organizations are there, and we can translate bureaucracy too. So with that, I would know we have a number of other speakers, and we can get to questions
just very quickly, Louise, what are you hearing from your community clinic partners about their clients, particularly in underserved communities, African American, Asian American, Pacific Islander?
I would say that a lot of folks our stories pan out with what was mentioned by our colleagues from the state, in that folks aren't reading their mail, or they're not returning the mail. The health centers are using text campaigns. They're sending text messages to their patients. They've got outreach workers. They have promotoras. They've got other folks working to get the message out. But it does, the data at the state rings true with what's happening here locally, and that a number of folks are letting that yellow packet slide. And sometimes it's because they may have moved. So if someone has moved during the course of the pandemic and their address has changed, that packet might be getting sent to the wrong place. So it's really important to folks, if you haven't seen the packet, reach out and we will help you navigate the system.
Thank you. Please stay on, because we'll have questions at the end. Next, we're going to hear from Rosario Arreola Pro, COO of the California Rural Indian Health Board. Thank you for joining us, Rosario.
Thank you. Thank you for having me be part of this distinguished panel. The California Rural Indian Health Board is a statewide tribal health association representing 19 tribal clinics and 59 tribes throughout California. Why does Medi-Cal redetermination matter to American Indians and Alaskan Natives in California? Well, Medi-Cal redetermination is an important matter to both the state and to tribal and urban Indian health programs throughout the state. There are 42 tribal and urban Indian health programs throughout California. Despite the federal trust responsibility with the federal government, tribal health programs receive less than 60% of the funds needed to provide care for tribes in California. Therefore, reimbursement through the Medi-Cal program ensures that supplemental funds are available to provide not just primary care, but also dental, mental health, and life-saving medications needed for American Indian and Alaska Native patients who need those services.
Could you speak a little more slowly for our interpreters? Thank you.
Yes, thank you. Anywhere between 30 to 60% of patients served by tribal clinics are Medi-Cal beneficiaries. Like other community clinics, tribal and urban Indian clinics are concerned about ensuring that there is no lapse in Medi-Cal coverage, particularly because so many people rely on Medi-Cal to access not only primary care, but also dental, mental health, specialty care, and emergency care services. What is happening now as the redetermination proceeds into its third month? Well, it is estimated that 1 in 5 Medi-Cal beneficiaries will lose their eligibility, either due to a lapse in eligibility or they are no longer eligible due to changes in employment. For many people, it has been 3 years since they last had to file paperwork for Medi-Cal. And this is why, for us, it is so important to get this messaging out to these communities. We are reminding folks that if you've moved in the last 3 years, that they need to make sure that their contact information is up to date so that they do not miss any of these letters from Medi-Cal. We are also encouraging folks to open their mail. I know that many of us hardly ever check our mailboxes anymore, but we really want to make sure that if they see something that looks like it's coming from the Medicaid office, that they open it. And if they have questions, and that they can seek assistance by calling or walking into their local tribal clinic to get the support that they need. In terms of what other guardrails are there in place to ensure continuous coverage for Medi-Cal beneficiaries, the California Rural Indian Health Board, along with the California Consortium for Urban Indian Health and the Department of Healthcare Services, have worked very diligently to ensure continuity of care for Medi-Cal patients post-pandemic. And just like many of our other partners, in addition to the work related to getting the word out about Medi-Cal redetermination, CRIB, the California Rural Indian Health Board, has worked closely with our state partners to ensure that telephone visits remain a reimbursable service for tribal clinics, especially those in rural and remote areas where internet service may not be reliable and a phone visit is preferred by a patient. So there is definitely a multi-pronged approach to ensure that there is continuity of care. That is very, very important to our communities. We're also messaging that we do have boots on the ground at the tribal and urban Indian health clinics. We are relying upon our clinic registration staff, as well as community health workers, and even transporters in rural and remote communities to help secure any documents that patients may need to apply for Medi-Cal or other covered California programs that they may be eligible for. As always, I just like to summarize with saying, just like many of our other partners, we're also relying heavily on outreach through Facebook, health fairs, powwows, phone calls, community health workers, and even friendly reminders by family members and staff when patients come in for an appointment or a review. So with that, pass it on to you, Sandy.
Thank you very much. Are you able to track data on Native American Medi-Cal enrollees by going to the dashboard? Have you checked on how Native Americans are faring with the redetermination by specific ethnic group?
At this point, we don't have data available. I will be also checking the dashboard that the DHCS has released. I know that sometimes it's harder because there's smaller numbers in terms of the American Indian Alaska Native population, but we certainly will be doing some of our own assessments to determine what that's looking like now that we're 3 months in.
That's terrific. Thank you very much. And please stay with us as we head to our next speaker, Dr. Cecilia Aquino with Latino Coalition for a Healthy California. Dr. Aquino.
Thank you so much. Buenos dias, and thank you to everybody for joining us this morning. I can only underscore how important this partnership is, right? With our government entities, with fellow CBOs, clinics, and you all with media. We all together play that role in keeping our communities safe. So thank you for all your support. From the Latino Coalition for a Healthy California, we represent over 40% of the population in California. That's 16 million Latinos. And for us, this issue is no small issue. Thank you to DHCS for the transparency and putting out this dashboard, which is so important in keeping Latinos healthy and safe. And the data showed that 53.2% of those that were disenrolled were actually Latinos. So that is a huge number. That is 1 in 3 Medi-Cal Latinos were disenrolled. And for us, that 117,849 figure is too many. And as you heard, we will continue to see that number rise. And this is not okay. For Latinos, you know, we are still recovering, and Latinos and other communities of color, we are still recovering from a devastating pandemic. So our health, our economies are very fragile, and Medi-Cal actually provides a way to safety, a way to opportunity, and a way to recovery. And so for us, it is extremely important that our members and our community remains enrolled. In May, CDPH data revealed that 42,000 Latinos were killed by COVID cases, and more than 4 million Latinos were seeing acute cases. This number can only hint at what we're recovering from, right? Not just acute cases, but long COVID, the socioeconomic disparities that came because of the pandemic. And so it is really on us to work extremely hard to maintain our Latino community members enrolled. I will say that communication has been key in the past few months. So what you heard about mail, text messaging, email, all of that has been very important in getting the word out. From what we see in community, and we have a listening tour across California where we're listening to community members on how they're receiving the information. From what we heard, there is still a lot of fear and confusion in terms of what to do, the logistics. The greater narrative is there, and people understand that these are changes that are coming and ongoing, but they don't understand the logistics, the how. We're also overrepresented in essential occupations. So for many of our community members, you know, we have 2 to 3 jobs. We are moving, we're busy. So it's hard to, you know, take the time to look through mail and really do that. And so when it comes to text messages, we hear that that is a key way to get the notice. However, there was a number missing from those text messages in terms of follow-up. Where do I go from here? So people know that it's happening, but they don't know how to follow up. So it's, for us, it's been very important to communicate those logistics to our community members in language. Also in language. So our community is not a monolith, it is diverse. And we have many indigenous Mesoamerican communities who have not been able to receive information in language, say Mixteco, Mayan, Mam, you name it, right? And Spanish is great, and it's a great first step, but we need to increase the diversity in those languages to make sure that all of our community members are receiving that information in language. As it comes to the mailed forms, those have been helpful for folks that are familiar with the process and understand how to go through that process. So we hear from those community members, they have been able to file. And because we are a very tight-knit community, a lot of members share that they have instructed other family members or neighbors to do the same. So that is working on the ground, but I would say it's taking a lot of work to get us there. As it comes to media and where you all can really help us is by getting the word out with specific logistics. So, you know, we hear about the reporting that's happening over Univision and Telemundo about the changes happening. But people, again, need that very one-on-one support. And we heard earlier about the navigators, right? Those numbers need to be shared. That contact information needs to be shared and accessible so that people know, okay, this is happening. Let me call someone. Let me get some help, especially if they have not received or they haven't been able to find their yellow envelope. I will say, and what keeps me up at night, right, is the challenges that we can still address. For one, that language access for Indigenous communities is so important. Data disaggregation at that level, right? This is beautiful and data can save lives. So I am so excited about the dashboard, but we need to go deeper into what Latinx means, right? And get specific numbers on different Indigenous Mesoamerican communities. And lastly, outreach will only do so much. You know, I come from public health, and from a public health perspective, we need to think about system solutions that will keep folks enrolled. We saw that because of the enhanced funding that was coming in at the federal level, that was supporting in keeping people enrolled through those automatic systems. We in California need to think about what that means for us. And it really is an investment, not only to our health, but our economy as well. When you keep people healthy, you keep your economy healthy. And so we really need to start thinking beyond outreach and think about system solutions so that we don't see that million number disenrollment going month by month. That is not fair for our community members, and we owe them the effort to keep them safe. I'll pause there.
Thank you so much. Your points are extremely helpful in understanding the high rate and the vulnerability of Latino enrollees in Medi-Cal. I'd like to ask Yingjia Huang, what does the dashboard tell us about African-American enrolled Medi-Cal enrollees and AAPI?
Yes, we do actually have this information. And of course, you're welcome to go and look at it. It's on slide 14. So in reviewing the demographic data from an ethnicity perspective, are the individuals that have identified themselves as African Americans, they only are about 5%, which is about 14,000 of the individuals that were disenrolled. So 5% of the 225,000 do self-identify themselves on the application as African American. And for our AAPI numbers, also it's about 2% of the disenrolled that have identified themselves as part of that a community. And this is 2% of the individuals that were disenrolled. So we think that, we are on the right track, and definitely more work to be done in all communities. But at least this is the first month, very preliminarily telling us this is kind of where we are with the various groups.
Thank you so much. Our last speaker is Mayra Alvarez, who actually was the first colleague who raised the very important information we needed to begin providing on redetermination some 2 years ago. So you're the last speaker on this panel, but you were the first speaker 2 years ago to call attention to this, Mayra. What can you tell us about the relevance of redetermination for California children and youth?
Thanks so much, Sandy, for the opportunity. And I want to be mindful of time. I want to make sure people will get to questions. So I want to just reiterate what has been said first, that all of us on this call today really are here because at both the public sector level and the community level, we're all trying to make sure families keep their coverage and that their children keep their coverage, especially as we come out of this public health emergency that has disproportionately hit communities of color. We know that health insurance coverage is incredibly important to our families. It's incredibly important to their livelihood. And 15 million of us depend on Medi-Cal for that security. But it's also 5.7 million children. Almost 60% of the kids in California rely on Medi-Cal. And those are overwhelmingly kids of color. Almost 70% of kids enrolled in Medi-Cal are children of color. So we want to make sure that as these changes are happening, that coverage continues to be available for every California family. And it's all of us together that are making sure we're taking the necessary steps so that they can keep that coverage. But as you have heard on this call, people are falling through the cracks. And it's especially important for those that are disproportionately impacted, like people of color, immigrant communities that are reading your papers, your blogs, your articles that really need to hear what is at stake for them. Even before the renewal process started, our own Department of Healthcare Services estimated that 2.3 million people in Medi-Cal would lose their Medi-Cal coverage. We estimate that is up to 1 million children losing their Medi-Cal coverage. Again, all of us on this call are working to ensure that families stay enrolled. And we are grateful to each other. It's incredible to see many of our friends part of this conversation. But with the recent data that was released by the department, we remain seriously concerned that families aren't able to access renewal. They're being procedurally disenrolled. In fact, of the thousands reported, close to 90% are procedurally disenrolled. That's higher than the national average. So the reality is we have to understand why. Why are they being disenrolled? How can we know more about they didn't want to renew or they just didn't bother, but that we can tackle, as Dr. Aquino said, those systemic barriers that are in place that are hindering access for far too many of our families. And so that families know where to get help, that it is absolutely the county that can help them, but it's also their community clinic, but it's also their navigator organization, community partners. We've created allinforhealth.org that links to many of the sites of our partners so that families can get this information from multiple channels of communication. And while it's going to take all of us to reach those people, we also want to ensure that we're helping improve that front end process so it goes as smoothly as possible for families. Keeping kids covered is the right thing to do. It's why last year, the legislature and the administration included multi-year continuous coverage for children 0 to 5. It's a policy that would remove jumping through these application hurdles for families. But unfortunately, that policy isn't set to go into effect until 2025. So we want to urge this legislature and administration to implement that policy as soon as possible so our kids aren't falling through the cracks, so no one has to fall through the cracks. Again, 15 million of us depend on Medi-Cal, including more than half of all kids. But it's one family, one child, one person that loses coverage unnecessarily. That's unacceptable. So this is an all hands on deck effort, and we are here to ensure that you, as trusted partners in the community, as trusted sources of information for our families, have the information that you need to share with our community members about the urgency of staying enrolled, of getting enrolled and staying enrolled. Because right now, we're talking about keeping our Medi-Cal coverage. Come January, when we're expanding Medi-Cal to more undocumented people, we want to ensure they get that message. So making sure our families have the information that they need now is going to put us on the right path to ensuring all of us are healthy tomorrow. Thank you so much for being part of this conversation, and I hope we have some time for questions.
We have had a very lively exchange of questions on the chat. Thank you to our speakers. Thank you to our reporters. A question from Manny Otico, I think, is very consistent with what many of us are wondering. What is it that makes it so difficult for people to fill out paperwork for renewal? And how can we improve this? I realize so much of the effort through social media posts and other outreach efforts by clinics, by the navigators, are all aimed at that central question. How do we get people to come in and really fill out the paperwork? Is there anything that you think is particularly effective in dealing with this dilemma? And particularly, Myra, you, because parents, if they don't fill out the forms, are at risk of jeopardizing their children's coverage.
I think the reality is, Sandy, as many of my colleagues have said, it's any number of issues. It's language barriers, it's confusion over the form, it's time to walk through the application when we're already stressed out in our daily lives. I don't want to say that it's one issue, but the opportunity to improve the process is what we're looking for. And many times people need someone to walk them through that application. I will tell you, I have a master's in healthcare administration, and walking my uncle through the Medicare application took me more time than I care to admit. It's a confusing process. And oftentimes we don't know where to go. So knowing that there's health centers, that there's navigator organizations, and that many sources are sharing that same resource list is so important. So for you all to share those informations so someone can go to Los Angeles or MODOC or San Diego and get the same list of resources in their community is especially important. Because again, it's going to take different approaches for different people, whether it's in person, on the phone, on the computer. And what matters is that we try and give them the support that they need to walk through that process so that they can keep or get their coverage.
Thank you. That is the question I'd now like to ask each of our speakers to address, which is, what can ethnic media do to help close the information gap on redetermination? What would the headline be that you want us to write that would most powerfully convey what you feel we need to convey to audiences around the Medi-Cal redetermination? And let's start with our first speaker, Yingjia. What is the headline message you want us to convey?
I think it's very important for our members to know redeterminations is here, it's back. Pay attention to your mail, pay attention to your text messages, pay attention to your emails, sign up at keepmedicalcoverage.org so we can reach you and send you reminders.
Hey, thank you. Jessica Altman with Covered California. What's the headline message you want us to give our audiences?
Great question, Sandy. So Yingjia's headline is the first headline, but my headline is the second headline, which is, if you are no longer eligible for Medi-Cal, there are still options for you to stay covered in California. Financial assistance is available. Many people may have access to coverage through their job, through a family member's job. That's great. But if a Californian is no longer eligible for Medi-Cal and needs coverage, Covered California is here to help connect those individuals and families to the coverage they need.
Thank you. Louise McCarthy with Community Clinic Association of LA County. What's your headline message for us, especially LA media?
Read your mail, ask for help. I put the link to find a clinic locator in the chat. And for those that are eligible for Medi-Cal, this is an entitlement program. You're entitled if you're eligible to these services. Don't leave them on the table.
Very good headline. Don't leave it on the table. Rosario Areola Pro with California Rural Indian Health Board, your headline for our media.
I would say, want to keep your Medi-Cal, open that yellow envelope. And I think for our media partners, showing someone even opening that envelope, kind of like looking at it, I mean, demystifying what is in an envelope. I think a lot of folks right now are challenged by what they get in the mail, what's real, what's not, the text that they're getting, what's real, what's not. So just showing an example of this is what it looks like, these are the steps, and just demystifying the hurdles to get this done.
I can also see the opposite end of that, which is you go to Walgreens with a prescription you fully expect to have filled, and then you're told, sorry, you no longer qualify for Medi-Cal. If that happens, what do our media tell people? When you're suddenly dropped, you may not even realize why. And that's the scariest thing that could happen. So I'm going to ask Dr. Cecilia Aquino, what is the headline if you go to the pharmacy and realize your Medi-Cal no longer covers your prescription?
Yeah, great question. I would say you have the power, stay enrolled. Many times for communities of color, we use a fear framing. We need power, not fear. So let's continue to encourage families that they have that power in their hands to enroll. And this is how, and quickly provide a number, an email, a link on where and how to find those items logistically.
Thank you. And last word to Myra Alvarez. What are you most encouraged by as you look at the first, as the data come in from the first month, but more to the point as people really begin to mobilize around this issue? What gives you the most encouragement?
I think it's conversations like this that show the diversity of individuals, organizations, and public sector partners that are committed to working together to ensure nobody falls through the cracks. It is going to take all of us to really ensure that families have the information they need to stay enrolled. So my headline is that the time is now and communities can get the support they need to stay enrolled. And it's on all of us to make that happen. So I'm encouraged by this partnership, by your leadership, and by the commitment that we're all making to keep every California family covered.
Thank you. I want to extend a special thanks to my longtime partner, California Black Media, which co-sponsored today's briefing, and to Regina Brown Wilson for joining this call, and for all of the media who took time to learn about and now report on Medi-Cal redetermination. Really appreciate your participation. And our thanks to the Department of Healthcare Services and Covered California for supporting this effort to reach as many audiences as possible. This campaign feels a little like the census. I think all of us have that instinct to want to go door to door, but using our platforms, I think, is going to be hugely important to bring this message home to everyone. Read your mail, go to the clinic. Don't take a rejection at Walgreens as the end of the road. This is you're entitled to this coverage, and the state is committed to ensuring continuous coverage. It's something that's made me personally feel proud of California. Thank you, and thanks so much for being part of this briefing. Our conference is now closed.